Hello friends, as you are aware, today we are celebrating the Sexual and Health Reproductive Day. Friends, do you know whatever happens inside the bedroom, although is very sacred and very personal to us, is completely dependent on how we deal in our day-to-day life. If I tell you that there is one treatment which will help you have better sexual function, have better relationships, reduce weight, have better lipid profiles, reduce the risk of heart disease, reduce the risk of forgetfulness, overall improve the quality of life, would you be interested in that? I am sure the answer to all your questions will be yes. And if I tell you that this treatment is not any drug or any injection or any surgery, it is just regular exercise. If I can convey one thing very clearly to all of you, that regular exercise and keeping your weight and overall health in check is the way to improve your sexual life and reproductive function, we would have done an important service for this day today. Now, how does exercise help? We know that the erectile function in a man is dependent on proper blood flow inside his genital organs. If the person does not exercise well, has increased weight gain, has associated blood pressure, diabetes, these are all the diseases which hamper the blood flow inside our blood vessels all over the body, and same thing would happen in the genitalia. Because of this, the erection will reduce and hence the sexual function will overall reduce. Once a person gains weight and has diabetes, a lot of male hormone, which is testosterone, gets blocked inside the subcutaneous and the body fat, and there is less male hormone to be utilized by our body, and hence the sexual desire and the sexual intensity would reduce. So have regular exercise, remain fit, stay away from tobacco in any form, reduce stress in your life, regular meditation, regular yoga would also help, deep breathing exercise extremely important, have healthy diet, and if you can do all this, definitely overall sex function will improve. It is really surprising and shocking that nearly 1 in 5 couple suffers from sexual dysfunction. This could be in the form of erectile dysfunction, that is where the erection doesn't happen well, reduced desire or reduced hypodesire syndrome, where though everything externally seems normal, the man or the lady is just not in mood to perform sex, or premature ejaculation, where the sexual act gets completed before either of the partner gets adequate satisfaction by the sexual act. 1 in 5 is a big number, and a lot of patients are there, or a lot of people are there who are unnecessarily suffering in silence without taking help where help is possible and help is easy. These days, if a person has any such problems, a complete health checkup will be done, which will include lipid profile, which will include testosterone levels, which will include investigations to rule out diabetes, blood pressure. Once they are done, if something wrong is found, that will be corrected. If not, excellent medications are available which will help you improve your sexual function and improve your lasting capacity. So the message will be, do not suffer in silence. If you have a problem, come forward, meet your doctor. Whenever you go to your physician for your blood pressure and diabetes, if such a problem is there, discuss with him. If needed, he will take help of a urologist or an andrologist who will help you sort out these issues. Before I sign off, to reduce the chance or to avoid them, reduce weight, high protein diet, deep breathing exercise and meditation, at least 40 minutes of brisk walking or high intensity exercise daily, control your sugar if you have diabetes, strict no to tobacco in any form. Now this cannot be overemphasized. Remember, you can have only one of the two pleasures, either cigarette or smoking. Both don't go together. If a person has regular cigarette, we know that nicotine blocks the small and medium sized blood vessels, and small and medium sized blood vessels are present in brain, heart, penis and kidney. So a person who smokes has high risk of brain stroke, has high risk of heart attack, high risk of kidney failure, apart from the various cancers that a smoking causes. So strict no to tobacco in any form. Last important thing is, remember that sexual function is an important part of life. Have regular sexual activity. Indulgence in sexual activity at least twice a week is very important. It is very healthy. Do not think that there is any age beyond which sex should stop. There are no religious scriptures which talk accounts against sexual function. So this is an important part of life. Indulge in it whenever both of you are in mood. It's a very good exercise at best. It improves your positive health promoting hormones and it gives you an overall feel good factor.